Thank you very much.
All right.
Firstly, I need to thank you all very much for this wonderful opportunity you all have given me to present this paper on behalf of HELYXON. HELYXON is a company I work for, and the paper is
Oh,
titled.
sorry, excuse me, Varun. I apologize for interrupting. Can you adjust your camera so we can see your face, please? Thank you. Thank you very much. That's perfect. Thank you.
And no one needs to apologize to me. Are you all able to see me clearly now? Is it clear now, please?
Yes, it is. To me, it is.
Okay. Firstly, as I thank you all so much for giving me this wonderful privilege to present the paper to you all on behalf of HELYXON, the company I work with. On behalf of HELYXON, when I present, the topic is titled The Prominent Role of IoT in the Field of Telemedicine and the Coefficient of Progressive Adaptation, done under the very generous guidance of Dr. Adrian Bradshaw by myself, Varun Mirle. Now, as I start off, first off, I can say that IoT encompasses everything the internet connects to. In these days, practically every device, you name it, it connects to it. Be it your laptop, be it your MacBook, be it your smartphone, be it your smartwatch, every other device practically. Therefore, it includes every single industry, including healthcare. This makes the entire world in this regard a global village. Now, specifically as I focus on good health and well-being of the 2030 sustainability agenda, these 2 points are of critical relevance. This is because quality care is made affordable and accessible to people in rural and remote places. This improves healthcare follow-up adherence as well. As all these devices now are connected with information systems and technology. Information systems and technology forms the backbone of healthcare delivery, as this includes artificial intelligence, real-time monitoring, data analysis, and knowledge management, again with regard to good health and well-being of the 2030 sustainability agenda. This increases the capacity of infrastructure for developing countries to manage communicable and non-communicable diseases. For sustainability requires consistent adaptation of improvements in protocol. The coefficient of progressive adaptation does come into place. The coefficient of progressive adaptation does state that the rate of change of progressive adaptation of the concerned information systems is directly proportional to the efficiency of the same, vice versa. To get into more detail about the same, I can use an example of a software. Say an information systems in the healthcare domain which requires a step-by-step procedure of 15 steps to complete. The same thing can very well be done with automation. That is why the core of the coefficient of progressive adaptation, the optimum efficiency method equation, is presented here. For example, in the 15-step process, which I just mentioned as the example, when automated, automation is the adaptation done by automation, theta. That's the most important thing. So optimum efficiency of the present methods when multiplied can be done very clearly in 8 steps. So in the 15-step process, optimum efficiency is done using 8 steps when automated. So present methods into theta multiplied by theta, which is present methods multiplied by automation, will give the optimum efficiency of 8 steps to be done, eradicating 7 steps, which are time consuming, no longer required, and had room for errors. Therefore, this has to be done accurately on a timely basis for the purpose of competitive advantage and optimum sustainability. When I speak about information systems adaptation, very clearly, this requires systematic planning and steering of information systems architecture. changes with technological aspects and organizational aspects both have to very well be taken into account for numerous benefits. A few of them are mentioned in this slide, such as automation, cost saving, reduce errors, predictability, enhanced consistency, improved quality, accelerating progress, and now specifically to only healthcare information systems, greater diagnostic precision, enhanced patient experience, and streamline digitization as well. For all this, only technology is not going to be adequate. That is for sure. We have to go beyond technology. It is the optimum integration of technology and change management together, thereby strategically linking healthcare information systems that form part of the IoT healthcare systems to the various IoT devices. IoT is the Internet of Health Things, and this is on a global scale. Therefore, adaptability and automation play a very crucial role in the same. Now, with real-time health systems to become the key to the IoT in the healthcare sector, and the COVID-19 pandemic acting as a catalyst transforming the entire healthcare industry, making telemedicine the new normal of medical practice and healthcare. This study aims to explore role of IoT in telemedicine and the application of the co-efficient of progressive adaptation, which I spoke about earlier, to healthcare information systems that form the medium of the Internet of Health Things, IoT. This study mainly uses literature review to review various journals, company reports, industry reports, and company websites as well. These two have been thematically analyzed by making two strata and analyzing them based on two themes, which are notable use of IoT in the field of telemedicine and adaptation of healthcare information systems. The analyzed data was ontologically linked by applying the coefficient of progressive adaptation. Going further into detail about the analysis done, I can very clearly state that even before the COVID-19 pandemic, a survey was done by Aruba, a Hewlett-Packard company. It very clearly noted well back in those days before the pandemic, as I've said, 76% of respondents believe that IoT would transform the healthcare industry. 80% of the healthcare industry benefited from the IoT, Internet of Things. Industry cost savings of 73% were noted right back then, as said before the pandemic itself. Now, as the pandemic has come in full swing, pandemic, as said, is utilizing the necessity and growth of telemedicine. That is one point. Moreover, reduced face-to-face consultations noted by the World Health Organization itself, which is a notable point as the World Health Organization has come into place in this regard. New technology adaptation has become an essential requirement. IoT devices, wearables, and sensors to be connected by information systems. This is, as said before, the healthcare information systems connecting the various devices, variables, and sensors to the IoT in the global healthcare market. Internet of Health Things very precisely. Speaking about the Internet of Health Things or the IoT in the global healthcare market, the scope is so vast that in this slide itself, it shows that a survey done by Markets and Markets predicted that in the year 2020, this is even before the pandemic came into full-fledged, the expected growth of IoT in the healthcare market is likely to reach $72.5 billion in the year 2020 itself. It was predicted to reach, and with a continuous annual growth rate of 21%, likely to reach 188.2 billion US dollars by 2025. Acquisitions and product launches offer lucrative opportunities in the next 5 years to come. Reduced cost of care and artificial intelligence technology will drive growth of IoT in the healthcare market. Rising deployment of IoT solutions in healthcare drives growth in the Asia-Pacific region as well. Therefore, as all these are connected with information systems, coming back to the point of constant adaptation in the field of information systems, firstly, I can very specifically emphasize on the fact that it is the internal changes done by the organization in order to face the external environment. Optimum integration is required of the technology and change management together for the competitive advantage. And these are strategically links the healthcare information systems as said to the various IoT devices. So adaptation of information systems to enable this competitive advantage has to be done by information system architecture changes on a continuous basis from time to time. Automation in the field of healthcare information system is a very notable point. So is adaptation as a part of successful knowledge management. Now, when I say successful knowledge management, I simply mean the principles of knowledge management, which is providing the right information to the right person at the right time, which in this case, obviously, is the information of the right patient to the right doctor at the right time, wherein the doctor is able to retrieve all the details of the patient, past records, present state, present diagnostic reports, and all from the place where it is stored. It may be a portal, it may be big data, it may be cloud, it may be from anywhere, but the doctor has to be able to retrieve it, and confidentiality of the patient and the communication of the doctor also has to be maintained with utmost coding as well. As all this is done through information systems which transfer the data, the coefficient of progressive adaptation is used as examples in healthcare information systems, showing how the coefficient of progressive adaptation is present and highly required in healthcare information systems simply by using 4 examples here itself. Firstly, in the first example, a healthcare information system was used for remote monitoring with several steps. Robotics and real-time health systems was used to adapt the same. This resulted in increased efficiency and accuracy, reduced turnaround time, and reduced error rates as well. Steps that were no longer required, steps which had a lot of room for errors, steps that were time consuming, were automated or assisted by robots, thereby reaping this efficiency. In the second example, a healthcare information systems was used to access patient information. Automation was used as a form of adaptation. This increased quality and consistency, reduced waste, increased predictability of outcomes, higher throughput rate, and data-driven insights were noted. Steps that were no longer required, as said, steps that were waste, steps that were reducing the quality and reducing consistency were eradicated and no longer used. In the third example, intelligent automation is adapted to a previous method, present method, which had a lot of steps to be done. That is why due to the adaptation to the intelligent automation, streamlining, greater diagnostic precision, and increased efficiency were observed. Redundant steps were eliminated. In the fourth example, the patients used to consult doctors online via phones, Skype, or various portals. For this, adaptation was done by implementing automation, artificial intelligence AI, and remote monitoring devices. Doing this, the patient was able to access any doctor in any location at any time, and it was done highly efficiently. This is because of the adaptation, and also because of the fact that steps no longer required for the remote monitoring were eradicated. All this put together, I would like to use a practical example of HELYXON itself. That's the company I work with. I'm using the example of this pulse oximeter as shown in this image. The pulse oximeter can be connected to the smartphone itself. This enables the doctor from any location to monitor 4 vital parameters of the patient such as SpO2, heart rate, temperature, and respiration rate. Vitals can be further assessed and remotely be monitored by physicians along with a live video consultation with the patient. This is one example I'm using. HELYXON does adapt the healthcare information systems from time to time. That is why we have a competitive advantage of our offerings. We have been recognized by the state government and been awarded by the Chief Minister as well for our efforts. This is one example I used. Along with the same, HELYXON also offers smartwatches, smart thermometers, fever watch, and other various remote monitoring devices. Now, a small device put on the patient's chest can enable the doctor from any location to even diagnose asthma in the patient from a distant location. You all are most welcome to always have a look at the HELYXON website. We'll be honored. Finally, I can very clearly conclude that telemedicine is growing on a global scale. So is the remote monitoring of healthcare. Again, coming back to the good health and well-being of the 2030 sustainability agenda, I can state that telemedicine growing on a global scale increase the capacity globally for health risk management and reduction. Remote monitoring of healthcare increases sustainability delivery of healthcare in developing countries. Therefore, the coefficient of progressive adaptability is present and highly required in healthcare information systems that form the backbone of delivery of healthcare. Not just on a national scale, on a global scale, connecting all the devices part of the IoT on a global scale, which are connected by the healthcare information systems. This is required for sustainability and resilience of healthcare as well. This point will be made very clearer just in the next point. Timely adaptation to change and risk is highly required, with no better example than the COVID-19 pandemic. As we all know, for decades and decades, if a patient required a particular doctor for a consultation, he or she would have to go to the hospital or to the doctor's clinic or healthcare facility and obtain the services in person. This was the practice and modus operandi for many decades, as said. Now, with the COVID pandemic, which came all of a sudden, doctors are likely to be very, very hesitant to come into any physical contact with the patient unless it is really, really inevitable. Patients also are very hesitant and apprehensive in going to any healthcare facility, obviously due to the risk of the COVID pandemic. As said, the COVID pandemic is acting as a catalyst transforming the healthcare industry, making telemedicine the new normal. Now with this new normal, for maximum efficiency, the healthcare information systems forming the backbone, as I said a couple of times, have to be adapted timely and accurately using the coefficient of progressive adaptability. I'll be very happy to answer all your questions. Just in case I am restricted by time, you all are most welcome to write to me, and you can write to me on my email ID, which is and I'll be happy to answer all your questions. As said, you all are most welcome to have a look at our website anytime and even contact us. We are very happy to collaborate with institutions and expand. So with regard to sustainability and resilience, I'm sure that I've communicated the meaning of the message to you all. Thank you all very much once again for your time.